Good morning. My name is Valerie Aguilar Dellisanti. I come from Lima, Peru, and I'm a rising junior at Brown University majoring in computer science, economics, and international public affairs. This summer, I had the amazing opportunity to work with Professor Catherine Tucker and her team at the Sloan Department, the MIT School of Management. On this occasion, this lightning talk I am presenting is titled The Failure of Government to Target Hispanics Through Online COVID-19 Vaccination Campaigns. The original project was meant to analyze differential vaccine ad targeting to various populations on Facebook Ads Library. Nevertheless, the deeper I dived into the analysis, the more I realized the strong disparities addressing the Latino population. This, combined with my Hispanic background, contributed to the shift to focusing on Latinos for the purpose of this study. It measures the role of social media on addressing Hispanics across the United States for immunization campaigns sponsored by the government. We use data from Facebook Ads Library, analyzing publicity sponsored by government agencies, giving emphasis to Spanish to English ad ratios, and comparing it to the Hispanic and Spanish-speaking populations in different states and in the whole country overall. The time frame for the study was between February 1st and July 15th of this year. Latinos have been disproportionately affected by the pandemic. The Hispanic population is the largest ethnic minority, comprising 18% of the US population. Additionally, around three-fourths of those Latinos speak Spanish at home, making it the most common non-English language spoken in this country. However, Hispanics are 1.7 times more likely to contract COVID-19 than their non-Hispanic white counterparts, 4.1 times more likely to be hospitalized, and 2.8 times more likely to die from it, and all this without taking into consideration the unparalleled economic burden. Democratic senators wrote in a letter to the White House that unvaccinated Latinos are more than twice as likely as unvaccinated whites to want a COVID-19 vaccine. Yet, they report that they are reluctant to seek them out due to continued misinformation about the vaccine costs, safety, and sick leave policies. It is not a surprise that there was a 45% increase in Spanish search queries since 2011, and 34% of those searches are related to healthcare and benefits. In fact, a study from 2020 by NBC explains that Hispanics are 57% more likely to use social media platforms as a primary source of information about coronavirus compared to non Hispanics. According to the Google Hispanic Custom Research from 2013, Hispanics are 16% more likely to visit government websites. During the pandemic, Spanish language news saw a 71% increase in social media activity that same year, while English media only 17%. Despite taking all of this into consideration, out of all active Facebook ads in the whole country sponsored by the government for improving immunization rates, only 6.7 are in Spanish. The five states with the largest Hispanic populations by number, California, Texas, Florida, New York, and Arizona, all have integrated Facebook ads as part of their immunization campaign. But four of those five states have extremely concerning proportions regarding the Spanish to English ad ratios we can see in the graph. California has 25.8% Spanish speakers, yet only 1% of ads target this population. Similarly, the case of Florida is not different. Florida has a 26.4% Hispanic population and 22.5% Spanish-speaking population, yet only 6% of the total government ads are in Spanish and none of them are active. In the case of New York, 1.1% of ads are in Spanish, but the Hispanic population accounts for 29.1%. And lastly, Arizona, with a state with 31% Hispanics and 20% Spanish speakers at home. However, 16% of active ads were in Spanish and currently zero are active. Additionally, the single Spanish long-lasting ad specified a residency requirement while the ones in English did not. We already know that there are persistently lower vaccination rates among Black and Hispanic people compared to their white counterparts across most states, leaving them at increased risk, particularly as the variant spreads. An important fact to note is that most Spanish ads sponsored by nonprofit organizations and other non-governmental agencies include term free, no residency proof, and no insurance required most of the time. An example is New York City, that as of June 1st, Latinos represented 16% of those fully vaccinated in New York City as compared to 43% of whites, and almost half of those in 75 priority zip codes feature abnormally low vaccination rates with less than 4% fully vaccinated according to New York Daily Times. We, in my opinion, are currently finishing up the details for the paper, and it is a very important topic to be addressed, especially right now with the new Delta variant, and it can be actively changed. As explained by the letter of the senators, it is about the access and not a hesitancy. This perspective can be incorporated into government policies and vaccination advertisements that specify how accessible they are, remaining free with no insurance or residency requirement. Vaccination rates will keep increasing, but only for those with information, and those without it will just fall behind and are at risk of being forgotten one more time. It is my hope that this can help bring awareness and improve at least a little bit the current situation of my community in this country. Thank you so much for your attention.